Should you walk with your knees bent? Hi, my name is Doug. I've been a physical therapist for 30 years and I specialize in helping people with balance problems learn to walk again. Should you walk with your knees bent? This is a pretty common question and I get asked this a lot. I notice that a lot of the patients that I see who are having falls tend to walk with their knees very stiff. Why do people do this? Well, partly it's habit. If you've had trouble with your balance or if you've ever had a fall, most people have a tendency to stiffen up. This is because of fear. Whenever you're afraid, there's a part of your brain that basically tells you that you need to stiffen up to be more safe. The problem is when you walk stiffly, it forces you to walk with your knees without a bend. Normally when someone walks, there's a 5 to 15 degree bend in their knee every time their heel hits the ground. This is what you see in normal walking in someone of any age, whether you're 5 years old or 95 years old. You should see a slight bend in the knee. That's considered the safest way to walk and basically the best posture for walking. The reason is when your knee is bent, you can absorb changes in your environment very easily. If your knee is stiff, if your knee is completely straight when you're walking, you have to unlock your knee to adjust to anything that's a change. So if you walk on something that's uneven or if suddenly there's a hole that you don't see or something in the way of your foot, if your knee is bent, it's a lot easier to adjust to that than if your knee is straight. If your knee is completely straight, you actually have to unlock your knee, which takes time. One of the leading causes of falls is walking with your knees overly stiff. So what you want to do is learn to walk with your knee slightly bent. One exercise that can help is this. Pillow step with knee bend. To do pillow stepping with knee bend, you'll need two things. You'll need a pillow or something soft to step on, and you'll also need a countertop nearby just for safety. To do the exercise, you want to basically stand on the ground and then step forward, making sure that when your heel hits the pillow, your knee is bent. Then, as your foot is on the pillow, you want to shift all your weight to the foot that's on the pillow. Then you want to step back again onto the ground and repeat with the other leg. You want to alternate right leg and left leg. Each time you're stepping forward, making sure that your knee is slightly bent. This exercise will help improve your knee proprioception and help you remember to always step on a bent knee. The normal gait pattern is to walk with your knee slightly bent and not hyperextended. Practicing this exercise over and over can help remind you to do this again. I recommend that you practice this for 5 minutes a day every day until you see an improvement. Whenever you walk, you should always have a 5 to 15 degree bend in each knee as your heel strikes the ground. I hope you found this video helpful. If you want to see more videos like this, please subscribe to my channel. And if you would like to work with a therapist or trainer that's trained in the techniques that you just saw, they can go to proprioceptiverehab.com to get training from me in exactly how to do this. I offer a course in proprioceptive rehabilitation for physical therapists and personal trainers.